So it's a change in someone's cognitive functions. So, for example, commonly people report that their relative is starting to repeat themselves or forgetting they've had conversations, forgetting appointments. Um, it depends where the dementia starts. It could be a change in personality, a flattening of affect. It could be some problems with calculations. Sometimes it can be problems with vision. So people actually can't drive as well. They start hitting wing mirrors off cars, or they go to the opticians because their eyes don't seem to be working properly and they keep being told the vision's normal, yet they don't seem to be able to process information. It really depends where the dementia starts. I think the point is that if you notice a change, then it needs looking into. Sometimes there can be other things which could give you the same symptoms. So, for example, if people are very stressed or sleep deprived or overloaded, they might start to have memory problems. But it can be subtle at the start, and therefore it's any change you need to be looking out for. So dementia goes up as people get older. When people are in their 80s, it's estimated something like 1 in 8, 1 in 5, even, depending on the studies. 1 in 8 people potentially are starting to develop dementia, so it's very common. Occasionally it's genetic, and therefore you're at risk if you have a family history of people developing dementia when they're young. If people are developing dementia in their 80s and 90s in your family, it's probably not genetic, but people with a genetic history are going to be at risk. People who develop vascular dementia due to damage to blood vessels and mini strokes, for example, are more at risk if they smoke or have high blood pressure. And there's some evidence looking at populations that certain groups are more at risk than others, but generally we don't know what causes dementia. We can't really identify most of the time who's at risk and who isn't. No, it's going to be different for different people. So you might see some patterns when you're a neurologist and you're meeting people in clinic regularly, but depending where the damage starts in the brain will depend what symptoms you experience. In Alzheimer's disease, which is obviously a common dementia and most people have heard of, the pathology normally starts in the memory parts of your brain. And the first symptoms people have are difficulty remembering conversations or forgetting information they're given. But it's going to depend on the individual, not only from the anatomy of which part of the brain is affected, but also that individual's personality and how they behave in these situations. So I would say no, people are not the same, everyone's different. So dementia is a terminal disease. The nerves start to wear out, they continue to wear out, and with time, it spreads. So often it starts with quite focal areas affected and therefore quite specific symptoms, but over time it will unfortunately spread to the rest of the brain. How long people live with dementia varies massively. It can vary depending on the age of onset, but most importantly, it seems to vary depending on the type of dementia and the type of pathology underlying it. So it's really hard to know what the prognosis is going to be for an individual when you first meet them. What I would also say, though, is that often things progress slower than people fear. And it's really important, therefore, to try and focus on all the aspects of the brain that are working very well when you get the diagnosis rather than just the areas which are affected. Yes. There's no single simple test for dementia. So you can't do a blood test, for example, and say, oh, you have 82% of something in your blood. If someone has a thyroid problem or a suspected thyroid problem, for example, you do a blood test and it can give you a number. In dementia, you can't diagnose it that way. You're diagnosing dementia based on the history with some tests to try and help support it and give you further information. So common tests are lumbar punctures, MRIs, psychology assessments. Occasionally we do other tests, but it can be hard to make a diagnosis. Some people notice problems with their memory, and it's only mild, and it's not enough to be affecting their day-to-day life, and that's often called mild cognitive impairment. Some of those patients each year will get worse, and then it will evolve into dementia, and some of them don't. So when people come to you, especially if they're coming early because they've noticed problems early on, it can be quite hard to diagnose sometimes, yes. So that's a very difficult question because we don't know what causes dementia in the majority of the cases. We do know that lots of repetitive little strokes on the brain, for example, can lead to dementia. So people need to keep an eye on blood pressure, the usual healthy lifestyle stuff, watch cholesterol, don't smoke, diabetes, etc. But most of the time, we don't understand why these nerves start to wear out faster than they should and why these proteins start damaging the brain. So it's actually very hard to know what people can do differently.